We look at two very important tests this evening, and this is the FADIR test and also the FABER test. FADIR test and also the FABER test. So I'm trying to talk about them. Okay, they are almost always done together. That's why we're also discussing them together. You can see the FADIR test, and the FABER test is just putting it away after you have done the FADIR test. They are almost always done together. Okay, so they are actually orthopedic tests, and they are used to evaluate hip joint pathology. Like they try to check if your hip is okay. Do you understand? Issues like all those Femoroacetabular impingement, and also labral tears and sacroiliac joint dysfunction. So FADIR test now is an abbreviation. The F there is flexion, A is adduction, okay, and the D2 is also the D in adduction. Then we'll have the internal rotation, which is the IR there. So the procedure is that the patient is lying and their face is up. So the examiner flexes the hip and the knee to about 90 degrees. So the hip is then adducted, moved inward, then internally rotated. So if there's pain in the groin or pain around the hip joint, it shows that there's a positive sign there. There's an issue there. It suggests that probably there's a femoral acetabular impingement, or there's a problem with the labrum. You understand? Then for the FABER test, the F there is flexion, abduction. Okay, it's not adduction now, it's abduction. You are bringing it close, and also external rotation. So flexion adduction is also known as a Patrick test. So procedure: the patient is lying and their face is up as usual. The examiner places the leg in a figure 4 position for FABER. Are you seeing it? Figure 4. You know, while the FADIR test, you can see the letter K. Do you understand? This is just a way of remembering it. So gentle downward pressure is applied to the flexed knee while stabilizing the opposite hip. So positive sign: if there's a lot of pain in the groin, shows you that there's issue with the hip. If there's pain in the sacroiliac joint or region, shows you that there's a sacroiliac joint dysfunction. You understand? So they also use this to differentiate between hip pathology and also sacroiliac joint pathologies. So this is another picture trying to show the FABER test and also the FADIR test.